guys, I'm Pam and I'm gonna be performing a catheterization on a patient today. What I want to do is review the order, make sure that I have the order for the catheterization. I'm gonna check the patient's chart for allergies to latex and iodine, and also collect my supplies, which would be the catheter kit, gloves, and a receptacle. What I want to do is walk into the patient's room, perform hand hygiene, identify myself, also go ahead and identify the patient. I'm going to provide for privacy and explain the procedure to the patient. I want to make sure that I provide some good lighting so I can see if my trash container is within reach. I want to go ahead and adjust the patient to a comfortable working position. And then what I want to do next is position the patient for the catheterization, which would be with thighs and hips slightly apart, and just expose the penis area. What I want to do is apply clean gloves, and I want to provide for perineal care, which would be washing the area with warm soap water. Then I want to remove my hands, perform hand hygiene again, and start maintaining my setting up my sterile field. I want to open the package. I want to dispose of this in the trash can. I want to open my lubricant jelly and leave it over here on the side, and then I'm going to start opening my sterile field. I want to make sure that I turn it. This makes it really easy for me to just go around and make sure everything stays sterile and I don't reach over anything. What I want to do next is apply my, what I'm going to do first is I'm going to put the KY jelly lubricant on my sterile field. I'm just going to go ahead and toss it. No more than 6 inches above the field. I'm going to go ahead and dispose of this in my container. I'm going to go ahead and place my waterproof pad, making sure that when I place it, it is placed with the shiny side down. Then I'm going to go ahead and place my sterile gloves. I honestly am not going to use this tray, so I'm just going to go ahead and dispose of it. And then I'm going to go ahead and put on my gloves. Starting from the inside, I'm going to grab it, go away from the sterile field, and then just slide it right in. With my right hand, I'm going to place it underneath the cuff, get the glove out of the sterile field, and place it above. Then I'm just going to go ahead and just leave that there. Honestly, I don't need to dispose of it right now. What I want to do next is move my sterile field over to the patient's new working sterile area. What I want to do next is remove the cap of the lubricant and place it on my tray. I'm going to go ahead and remove the saline cap as well and dispose of both of them in there. What I want to do next is making sure that I keep all of this sterile. I'm going to go ahead and place my saline solution in here, and then I'm going to remove the packaging of the catheter tip. I'm going to place it with my sterile supplies right there. I'm going to remove this, and then what I want to start doing next is, since my patient is male, right before that I'm just going to go ahead and open my iodine or cleaning supply, and I'm going to squirt the solution all over the cotton walls, and then I'm going to dispose of this. What I want to do next is with my non-dominant hand, I'm going to go ahead and grab the penis, and I'm going to start cleaning it. I am going to do this with my forceps and circular motion, and I'm going to use one cotton ball and start from the meatus down and dispose. Then I'm gonna take another cotton ball, I'm gonna clean from the meatus down and then dispose. And then I want to do this one more time and make sure that the area is really clean. I'm going to dispose of my catheter, and then I want to, since this area is clean and I'm not gonna be moving my hand, I'm gonna take my dominant hand and I'm going to insert the lubricant jelly into the meatus, and I am going to squirt this out. After this is done, I'm going to remove this, and after that I'm going to grab my catheter and I am going to just go ahead and grab the whole bag, the whole packaging, and just place it onto my sterile field. And then what I want to do next is I want to start inserting the catheter. What I'm going to do is I'm going to ask the patient to take a deep breath, and I'm going to insert a little bit. Then I'm going to ask them to take a deep breath, and I'm going to insert a little bit, then insert a little more as they're taking a deep breath. And after I see some urine, I'm going to keep inserting until I reach the bifurcation of the catheter. What I'm going to do next will be grab the catheter with my non-dominant hand by the meatus, and I'm going to instill all the saline water into the catheter. I'm going to remove the syringe and I'm going to dispose of it. At this point, my catheter should be placed secured. What I'm going to do next is basically just pull it slightly out until I feel some resistance, which means that the bladder would be placed into the patient's which means that the catheter will be placed into the patient's bladder. What I'm going to do next is put the patient's foreskin if the patient is not circumcised, and then I'm going to remove my gloves, and I'm going to put on I'm going to perform hand hygiene and put on a pair of clean gloves. And what I'm going to do next is clean the patient's penis. If there's any lubricant jelly left or anything like that, I'm going to place the catheter bag underneath the patient's bladder. And then what I want to do is make sure I secure the catheter to the patient's thigh. And then I'm going to remove my supplies. Once my patient's catheter has been secured and the bag is below the patient's level, I'm going to cover my patient. I'm going to remove my gloves, perform hand hygiene. I'm going to put the bed in the lowest position, and then I'm going to just clean my hands again, perform hand hygiene, and then I'm going to document, and I'm going to see how the patient tolerated the procedure. I'm going to provide the call bell within reach, and then I'm going to leave the room. With this, my catheterization is over. Thanks for watching.